February is American Heart Month, and joining me to discuss the importance of vascular and heart screenings is Dr. Naveen Purowit. Thanks for being here.
Hi, thanks for having me.
Yeah, so tell us a little bit about, why these screenings are so important.
Yeah, cardiovascular disease is the #1 cause of death in the U.S. and across the world, and that has been the case for more than 100 years. A lot of patients will come to us with symptoms and we take care of the problem, but there's actually a lot of patients who are walking around, they have heart issues, however, they're not aware. Well, how do we find those patients? How do we bring them to our practice and take care of their problems? And that's where the screenings come in. So the heart screening, the most important component of that is a calcium score. That's a way where we can see how much plaque may have built up in the heart arteries already, and the patients actually get a score. So, 0 is great, no calcified plaque, and the higher the score, the worse it is. In addition to that, we do some other testing. We do an EKG, make sure there's no electrical issues going on, do some blood work, check their cholesterol numbers. The vascular screening involves checking the neck arteries to make sure there's no plaque built up there, because that can lead to strokes. Looking at the aorta, make sure there's no aneurysm and blood flow in the leg. So it's a very nice and a quick way of just screening the body for any cardiovascular diseases.
Yeah, and who should be getting these screenings? When should they go in?
In general, anybody above the age of 40, between 40 and 65 is where we recommend you get these screenings now. One very important distinction: if you're having symptoms and you've been thinking about seeing your doctor, don't just go for the screening. Go see your doctor. There could be something going on. This is more for patients who feel great, they're asymptomatic. However, they either have a strong family history, they're worried about it, they just want to know more. Those would be the patients. So in short, asymptomatic patients who may have some risk factors.
Okay, and if people have symptoms, what are some of those symptoms to look out for?
Yeah, good question. Well, the symptoms of heart disease really depend on what the underlying condition is. So like we said, it could be nothing. You may not have any symptoms and still have heart disease if you have genetics or family history. However, the most common symptoms that we notice is chest discomfort. It may not be pain, it may be just heaviness, pressure. Sometimes it's not even in the chest, it may be in the shoulder or the left arm or the jaw or even the back. Shortness of breath with exercise or exertion is a very important one. If there are issues with electrical system in the heart, often it's palpitations, feeling the heart skipping or being out of rhythm, fluid retention, fluid buildup in the legs, fatigue, being tired.
And for these screenings, what's the process for that? Is it fairly easy, simple? How do the screenings work?
Yeah, the screenings are very simple. We at Sanford, we have a screening program. You can just call a number and just set up those screenings. You can talk to your primary care doctor that you're interested in those screenings. We get it done most of the times. It's just scheduled. It's the heart screening is less than 5 minutes.
Wow.
The vascular screening is an ultrasound. It's usually done within less than 30 minutes, and you get your results right away.
Wow, so fairly simple then for people out there.
Absolutely.
Yeah. Well, thank you so much for being here.
Yeah, thanks for having me.
Stick around, we have more after the break.